During the treatment process, you'll hear us talk about the idea that we're finding nerve endings that have become sensitive. But why does this happen? So if I break my elbow, and my elbow has healed as best as it ever will, then potentially, in order to protect myself from re-injuring that area, it's a normal thing for the brain to create now a heightened sensitivity in that area because it wants to stop me injuring it again. And so trauma is the first reason for nerve endings that become sensitive. The second reason is simple overuse. If I have a repetitive strain injury where I'm doing excessive amounts of typing, for example, then I'm going to create some heightened sensitivity. And the third reason is more to do with a concept that we use called neurological health. And this is simple. If my brain is overwhelmed with information, I'm highly stressed, I've got lots going on, and then perhaps I start using my elbow a little bit, then it can't contemplate all this information at once. And so it may perceive now that this is a threat because it's just overwhelmed. And so those are the three reasons in which we can create heightened sensitivity in an area. Having heightened sensitivity in an area isn't directly going to cause you pain, but it most definitely increases the likelihood. And so we want to try and reduce that sensitivity so that at the very least, your brain is getting normal information from that elbow, and so it doesn't believe that there's any excessive threat. For example, what should happen is all nerve endings everywhere, which are mostly located in the skin or the tendons or ligaments, have a normal level of activity. And what this is around minus 70 millivolts. It's just electrical activity, where that nerve ending is detecting information constantly, 24/7, about the degree of information. So if it was a nerve ending that detects stretch, it's always looking at, is there any stretch? Is there any stretch? If I stretch that area a little bit, the signal changes. It gets a little bit higher, but nothing really happens. If I overstretch my elbow, that signal is going to go high enough to some kind of threshold, which usually is around minus 50 millivolts. It gets more positive because there's some changes in the electrical charge around the area. And as that threshold is hit, information gets sent to the brain, and then you either become aware of the pain or you have a reflexive action where you protect the area because it was overstretched. The problem is that when it becomes oversensitive because of trauma, overuse, or overwhelm, then that resting level of activity changes. It gets much closer to the threshold. So now it only takes a very normal amount of stretch for my brain to perceive a huge stretch, and so you're more likely to feel pain. Using the method we've already talked about, which is finding those areas of sensitivity and its compensation, we can reset that level back to the normal minus 70 millivolts to then have a normal amount of movement without threat.
Cool.